Hi, everyone. This is Nurse Anna from nursestudy.net, and we have another 75 questions for you today. Immune disorders, nursing questions, answers with rationales. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A patient with systemic lupus erythematosus, SLE, is admitted with severe joint pain and fatigue. Which laboratory test result is most indicative of a lupus flare? A. Elevated erythrocyte sedimentation rate, ESR. B. Positive antinuclear antibody, ANA, titer. C. Increased creatinine level. D. Low complement levels, C3 and C4. Answer. D. Low complement levels, C3 and C4. Rationale. Low complement levels, C3 and C4, are indicative of active lupus because they are consumed during the inflammatory process. Elevated ESR and positive ANA are common in many autoimmune disorders and are not specific to lupus flares. Increased creatinine may indicate renal involvement but does not directly indicate a flare. Question 2. A nurse is assessing a patient with multiple sclerosis, MS. Which symptom is most likely to be observed? A. Ascending paralysis. B. Bradykinesia. C. Visual disturbances. D. Mask-like facies. Answer. C. Visual disturbances. Rationale. Visual disturbances, such as blurred vision or diplopia, are common early signs of MS due to demyelination of the optic nerve. Ascending paralysis is associated with Guillain-Barré syndrome, bradykinesia with Parkinson's disease, and mask-like facies with Parkinson's disease as well. Question 3. A patient with rheumatoid arthritis, RA, is prescribed methotrexate. What is the most important teaching point for this medication? A. Avoid taking with dairy products. B. Take with a full glass of water. C. Report any signs of infection immediately. D. Limit intake of green leafy vegetables. Answer. C. Report any signs of infection immediately. Rationale. Methotrexate is an immunosuppressant, and patients are at increased risk for infections. Reporting signs of infection is critical. While taking with water is a good practice, it is not as crucial as infection monitoring. Avoiding dairy or green leafy vegetables is not specifically related to methotrexate. Question 4. A nurse is caring for a patient with myasthenia gravis, MG. Which symptom would be most concerning for the nurse to report immediately? A. Muscle weakness. B. Ptosis. C. Difficulty swallowing. D. Diplopia. Answer. C. Difficulty swallowing. Rationale. Difficulty swallowing can lead to aspiration and respiratory complications, which are life-threatening in MG patients. Muscle weakness, ptosis, and diplopia are common symptoms but are not immediately life-threatening. Question 5. A patient with HIV is admitted with pneumocystis pneumonia, PCP. Which medication is the primary treatment for PCP? A. Azithromycin. B. Trimethoprim sulfamethoxazole. C. Fluconazole. D. Ganciclovir. Answer. B. Trimethoprim sulfamethoxazole. Rationale. Trimethoprim sulfamethoxazole, Bactrim, is the drug of choice for treating PCP in HIV patients. Azithromycin is used for bacterial infections, fluconazole for fungal infections, and ganciclovir for cytomegalovirus, CMV, infections. Question 6. A patient with scleroderma presents with severe Raynaud's phenomenon. Which medication is likely to be prescribed to manage this condition? A. Beta blockers. B. Calcium channel blockers. C. ACE inhibitors. D. Diuretics. Answer B. Calcium channel blockers. Rationale. Calcium channel blockers, such as nifedipine, are often prescribed to manage Raynaud's phenomenon by helping to dilate blood vessels and improve blood flow. Beta blockers can exacerbate symptoms, while ACE inhibitors and diuretics are not first-line treatments for Raynaud's. Question 7. A patient with chronic granulomatous disease, CGD, is at increased risk for infections. What type of organisms are they most susceptible to? A. Fungal infections. B. Gram-negative bacteria. C. Gram-positive bacteria. D. Catalase-positive organisms. Answer D. Catalase-positive organisms. Rationale. Patients with CGD have a defect in their phagocytes, making them particularly susceptible to catalase-positive organisms such as Staphylococcus aureus, Aspergillus species, and others. They are also at risk for fungal infections, but the defining susceptibility is to catalase-positive organisms. Question 8. A nurse is caring for a patient with Guillain-Barré syndrome, GBS. What is the most critical assessment to prioritize? A. Blood pressure monitoring. B. Reflex assessment. C. Respiratory status. D. Pain level. Answer C. Respiratory status. Rationale. GBS can lead to rapid progression of muscle weakness, including the respiratory muscles. Monitoring respiratory status is critical to identify early signs of respiratory failure. Blood pressure, reflexes, and pain are also important but not as critical as respiratory assessment. Question 9. A patient with Hashimoto's thyroiditis presents with severe fatigue and weight gain. What laboratory result is most likely to be elevated? A. T3. B. T4. C. Thyroid stimulating hormone, TSH. D. Free thyroxine, FT4. Answer C. Thyroid stimulating hormone, TSH. Rationale. In Hashimoto's thyroiditis, an autoimmune condition leading to hypothyroidism, TSH levels are typically elevated as the pituitary gland tries to stimulate the thyroid. T3 and T4 are usually low or normal. Question 10. A nurse is educating a patient with Sjogren's syndrome about managing their symptoms. Which recommendation is most appropriate? A. Use high-dose corticosteroids daily. B. Increase intake of caffeinated beverages. C. Use artificial tears and saliva substitutes. D. Restrict fluid intake. Answer C. Use artificial tears and saliva substitutes. Rationale. Sjogren's syndrome primarily affects the exocrine glands, leading to dry eyes and mouth. Using artificial tears and saliva substitutes can help manage these symptoms. High-dose corticosteroids are not typically used for symptom management, and caffeinated beverages and fluid restriction are not advised. Question 11. A patient with hemolytic anemia due to autoimmune causes is being treated with corticosteroids. Which laboratory result would indicate a positive response to treatment? A. Decreased respiratory count. B. Increased hemoglobin level. C. Elevated bilirubin level. D. Low haptoglobin level. Answer B. Increased hemoglobin level. Rationale. An increase in hemoglobin levels would indicate a positive response to treatment as it suggests a reduction in hemolysis. A decreased respiratory count, elevated bilirubin, and low haptoglobin are associated with ongoing hemolysis. Question 12. A patient with ankylosing spondylitis is experiencing significant back pain and stiffness. What is the most appropriate non-pharmacologic recommendation? A. Bed rest during flares. B. High-impact aerobic exercises. C. Regular physical therapy and stretching exercises. D. Use of lumbar support braces. Answer. C. Regular physical therapy and stretching exercises. Rationale. Regular physical therapy and stretching exercises help maintain spinal flexibility and reduce stiffness in patients with ankylosing spondylitis. Bed rest and high-impact exercises are not recommended, and lumbar braces are not typically used as a primary treatment. Question 13. A patient with chronic idiopathic urticaria, CIU, is being treated with antihistamines. Despite treatment, the patient continues to experience severe symptoms. What additional medication might be considered? A. Beta blockers. B. Leukotriene receptor antagonists. C. Calcium channel blockers. D. ACE inhibitors. Answer. B. Leukotriene receptor antagonists. Rationale. Leukotriene receptor antagonists, such as montelukast, can be used as an adjunct therapy in CIU when antihistamines alone are insufficient. Beta blockers, calcium channel blockers, and ACE inhibitors are not indicated for this condition. Question 14. A patient with severe combined immunodeficiency, SCID, presents with frequent infections. What is the primary treatment for SCID? A. Regular antibiotic prophylaxis. B. Bone marrow or stem cell transplantation. C. Immunoglobulin replacement therapy. D. High-dose corticosteroids. Answer. B. Bone marrow or stem cell transplantation. Rationale. The primary treatment for SCID is bone marrow or stem cell transplantation, which can restore immune function. Antibiotic prophylaxis and immunoglobulin replacement are supportive therapies, while corticosteroids are not used as primary treatment. Question 15. A nurse is educating a patient with celiac disease about dietary management. Which food should the patient avoid? A. Rice. B. Corn. C. Barley. D. Potatoes. Answer. C. Barley. Rationale. Patients with celiac disease must avoid gluten, which is found in barley, wheat, and rye. Rice, corn, and potatoes are naturally gluten-free and safe to consume. Question 16. A patient with dermatomyositis is prescribed prednisone. What is the most important side effect for the nurse to monitor for? A. Hyperglycemia. B. Bradycardia. C. Weight loss. D. Hypotension. Answer. A. Hyperglycemia. Rationale. Prednisone, a corticosteroid, can cause hyperglycemia, especially with long-term use. Monitoring blood glucose levels is important. Bradycardia, weight loss, and hypotension are not common side effects of prednisone. Question 17. A patient with Goodpasture syndrome presents with hemoptysis and hematuria. What is the primary treatment goal? A. Increase fluid intake. B. Suppress the immune response. C. Administer high-dose antibiotics. D. Perform surgical resection of affected tissues. Answer. B. Suppress the immune response. Rationale. Goodpasture syndrome is an autoimmune disease characterized by antibodies attacking the basement membrane in the lungs and kidneys. The primary treatment goal is to suppress the immune response using medications like corticosteroids and immunosuppressants. Increasing fluid intake, administering antibiotics, or surgical resection are not primary treatment strategies. Question 18. A patient with chronic myeloid leukemia, CML, is being treated with imatinib. What is the mechanism of action of this drug? A. Inhibits DNA synthesis. B. Stimulates bone marrow production. C. Inhibits BCR-ABL tyrosine kinase. D. Promotes apoptosis in leukemic cells. Answer: C. Inhibits BCR-ABL tyrosine kinase. Rationale: imatinib is a tyrosine kinase inhibitor that specifically targets the BCR-ABL fusion protein found in CML cells, thereby inhibiting their growth and proliferation. It does not inhibit DNA synthesis, stimulate bone marrow production, or directly promote apoptosis. Question 19. A nurse is caring for a patient with severe allergic asthma. Which biologic agent may be prescribed to manage this condition? A. Methotrexate. B. Omalizumab. C. Cyclosporin. D. Azathioprine. Answer: B. Omalizumab. Rationale: omalizumab is a monoclonal antibody that targets IgE and is used to manage severe allergic asthma. Methotrexate, cyclosporin, and azathioprine are used for other autoimmune conditions, but are not specific for allergic asthma. Question 20. A patient with Sjogren's syndrome is experiencing severe dry mouth. Which medication may help alleviate this symptom? A. Hydroxychloroquine. B. Pilocarpine. C. Methotrexate. D. Azathioprine. Answer: B. Pilocarpine. Rationale: pilocarpine is a cholinergic agonist that stimulates saliva production, helping to alleviate dry mouth in Sjogren's syndrome. Hydroxychloroquine, methotrexate, and azathioprine are used for other symptoms or conditions. Question 21. A patient with chronic lymphocytic leukemia, CLL, is being treated with rituximab. What is the primary target of this medication? A. T lymphocytes. B. B lymphocytes. C. Myeloid cells. D. Erythrocytes. Answer: B. B lymphocytes. Rationale: rituximab is a monoclonal antibody that targets CD20, a protein found on the surface of B lymphocytes. It helps to deplete B cells in conditions such as CLL. It does not target T lymphocytes, myeloid cells, or erythrocytes. Question 22. A nurse is educating a patient with systemic sclerosis, scleroderma, about managing Raynaud's phenomenon. Which instruction is most appropriate? A. Apply ice packs to affected areas. B. Avoid smoking and caffeine. C. Wear tight-fitting gloves and socks. D. Increase intake of sodium-rich foods. Answer: B. Avoid smoking and caffeine. Rationale: avoiding smoking and caffeine can help manage Raynaud's phenomenon by preventing vasoconstriction. Applying ice packs, wearing tight-fitting gloves and socks, and increasing sodium intake are not appropriate recommendations. Question 23. A patient with HIV is starting antiretroviral therapy, ART. Which class of ART drugs works by inhibiting reverse transcriptase? A. Protease inhibitors. B. Integrase inhibitors. C. Nucleoside reverse transcriptase inhibitors, NRTIs. D. Fusion inhibitors. Answer: C. Nucleoside reverse transcriptase inhibitors, NRTIs. Rationale: NRTIs inhibit the reverse transcriptase enzyme, preventing the conversion of viral RNA into DNA. Protease inhibitors inhibit protease, integrase inhibitors inhibit integrase, and fusion inhibitors prevent viral entry into cells. Question 24. A patient with chronic idiopathic urticaria is not responding to standard antihistamine treatment. What additional medication might be considered? A. Beta blockers. B. Leukotriene receptor antagonists. C. Calcium channel blockers. D. ACE inhibitors. Answer: B. Leukotriene receptor antagonists. Rationale: leukotriene receptor antagonists, such as montelukast, can be used as an adjunct therapy in chronic idiopathic urticaria when antihistamines alone are insufficient. Beta blockers, calcium channel blockers, and ACE inhibitors are not indicated for this condition. Question 25. A patient with rheumatoid arthritis, RA, is experiencing a severe flare. Which medication is likely to be prescribed for rapid symptom relief? A. Methotrexate. B. Prednisone. C. Hydroxychloroquine. D. Sulfasalazine. Answer: B. Prednisone. Rationale: prednisone, a corticosteroid, is often prescribed for rapid relief of severe RA flares due to its potent anti-inflammatory effects. Methotrexate, hydroxychloroquine, and sulfasalazine are used for long-term management. Question 26. A patient with HIV is diagnosed with Kaposi's sarcoma. What is the primary cause of this condition? A. Epstein-Barr virus. B. Cytomegalovirus. C. Human herpes virus 8. D. Human papillomavirus. Answer: C. Human herpes virus 8. Rationale: Kaposi's sarcoma is primarily caused by human herpes virus 8, HHV8. Epstein-Barr virus is associated with other lymphoproliferative disorders, cytomegalovirus with CMV infections, and human papillomavirus with genital warts and certain cancers. Question 27. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who is experiencing nephritis. Which laboratory test is most important to monitor? A. Complete blood count, CBC. B. Serum creatinine. C. Liver function tests, LFTs. D. Serum calcium. Answer: B. Serum creatinine. Rationale: serum creatinine is an important indicator of kidney function and should be closely monitored in SLE patients with nephritis. CBC, LFTs, and serum calcium are also important but not as directly related to nephritis. Question 28. A patient with myasthenia gravis, MG, is prescribed pyridostigmine. What is the primary action of this medication? A. Increases acetylcholine breakdown. B. Inhibits acetylcholinesterase. C. Stimulates dopamine receptors. D. Blocks calcium channels. Answer: B. Inhibits acetylcholinesterase. Rationale: pyridostigmine inhibits acetylcholinesterase, increasing the availability of acetylcholine at the neuromuscular junction, thereby improving muscle strength in MG patients. It does not stimulate dopamine receptors or block calcium channels. Question 29. A patient with systemic sclerosis is experiencing severe skin tightening and contractures. What is the primary treatment goal? A. Reduce skin inflammation. B. Improve skin hydration. C. Prevent further contractures. D. Increase skin elasticity. Answer: C. Prevent further contractures. Rationale: the primary treatment goal for systemic sclerosis with severe skin tightening is to prevent further contractures through physical therapy and other interventions. Reducing inflammation and improving hydration are also important but secondary. Question 30. A nurse is educating a patient with hereditary angioedema about avoiding triggers. Which of the following should be included in the teaching? A. Avoiding strenuous exercise. B. Limiting fluid intake. C. Using ACE inhibitors. D. Avoiding contact sports. Answer: D. Avoiding contact sports. Rationale: avoiding contact sports can help prevent trauma-induced angioedema attacks in patients with hereditary angioedema. Strenuous exercise and limiting fluid intake are not relevant, and ACE inhibitors should be avoided as they can trigger attacks. Question 31. A patient with systemic lupus erythematosus, SLE, is experiencing severe joint pain. Which medication is most likely to be prescribed for symptom relief? A. Hydroxychloroquine. B. Methotrexate. C. Azathioprine. D. Ibuprofen. Answer: D. Ibuprofen. Rationale: ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, is commonly prescribed for relief of joint pain in SLE. Hydroxychloroquine, methotrexate, and azathioprine are used for disease-modifying purposes. Question 32. A nurse is caring for a patient with autoimmune hemolytic anemia. Which sign is most indicative of this condition? A. Jaundice. B. Bradycardia. C. Hypertension. D. Polyuria. Answer: A. Jaundice. Rationale: jaundice is a common sign of hemolysis due to the increased breakdown of red blood cells and subsequent rise in bilirubin levels. Bradycardia, hypertension, and polyuria are not typically associated with hemolytic anemia. Question 33. A patient with psoriasis is prescribed a topical corticosteroid. What is the primary goal of this treatment? A. Prevent infection. B. Reduce inflammation. C. Moisturize the skin. D. Promote cell turnover. Answer: B. Reduce inflammation. Rationale: topical corticosteroids are primarily used to reduce inflammation and suppress the immune response in psoriasis. Preventing infection, moisturizing the skin, and promoting cell turnover are secondary goals. Question 34. A patient with primary immunodeficiency is receiving immunoglobulin replacement therapy. Which adverse effect should the nurse monitor for? A. Hypertension. B. Anaphylaxis. C. Hyperglycemia. D. Tachycardia. Answer: B. Anaphylaxis. Rationale: anaphylaxis is a potential adverse effect of immunoglobulin replacement therapy, requiring close monitoring during and after administration. Hypertension, hyperglycemia, and tachycardia are not common adverse effects of this therapy. Question 35. A nurse is caring for a patient with an acute exacerbation of systemic lupus erythematosus, SLE. Which clinical manifestation requires immediate intervention? A. Fever of 100 degrees Fahrenheit, 37.8 degrees Celsius. B. Oral ulcers. C. Peripheral edema. D. Chest pain and shortness of breath. Answer: D. Chest pain and shortness of breath. Rationale: chest pain and shortness of breath may indicate pericarditis or pleuritis, which are serious complications of SLE that require immediate intervention. Fever, oral ulcers, and peripheral edema are common but less urgent symptoms. Question 36. A patient with Hashimoto's thyroiditis is at increased risk for developing which condition? A. Hyperthyroidism. B. Addison's disease. C. Type 1 diabetes. D. Systemic sclerosis. Answer: C. Type 1 diabetes. Rationale. Hashimoto's thyroiditis is an autoimmune disorder, and patients with one autoimmune condition are at increased risk for developing others, such as type 1 diabetes. Hyperthyroidism, Addison's disease, and systemic sclerosis are less commonly associated. Question 37. A nurse is caring for a patient with multiple myeloma. Which laboratory finding is most indicative of this disease? A. Elevated white blood cell count. B. Hypercalcemia. C. Hypokalemia. D. Increased hematocrit. Answer. B. Hypercalcemia. Rationale. Hypercalcemia is a common finding in multiple myeloma due to bone breakdown and release of calcium into the bloodstream. Elevated white blood cell count, hypokalemia, and increased hematocrit are not specific to multiple myeloma. Question 38. A patient with systemic sclerosis presents with severe gastrointestinal symptoms. Which medication may be prescribed to manage esophageal dysmotility? A. Proton pump inhibitors. B. Beta blockers. C. Anticholinergics. D. ACE inhibitors. Answer. A. Proton pump inhibitors. Rationale. Proton pump inhibitors can help manage esophageal dysmotility and gastroesophageal reflux in patients with systemic sclerosis by reducing stomach acid production. Beta blockers, anticholinergics, and ACE inhibitors are not indicated for this symptom. Question 39. A nurse is educating a patient with chronic idiopathic urticaria about potential triggers. Which substance should the patient avoid? A. Aspirin. B. Antihistamines. C. Corticosteroids. D. Antibiotics. Answer. A. Aspirin. Rationale. Aspirin and other NSAIDs can trigger or worsen chronic idiopathic urticaria. Antihistamines, corticosteroids, and antibiotics are not typical triggers for this condition. Question 40. A patient with HIV is starting antiretroviral therapy, ART. What is the primary goal of this treatment? A. Cure the infection. B. Suppress viral load. C. Prevent transmission. D. Increase CD4 count. Answer. B. Suppress viral load. Rationale. The primary goal of ART is to suppress the viral load to undetectable levels, thereby improving immune function and reducing the risk of transmission. While increasing CD4 count and preventing transmission are also goals, they are secondary to viral suppression. Question 41. A patient with autoimmune hepatitis is being treated with azathioprine. What is the primary action of this medication? A. Suppresses immune response. B. Stimulates liver regeneration. C. Increases bile flow. D. Reduces inflammation. Answer. A. Suppresses immune response. Rationale. Azathioprine is an immunosuppressant that helps reduce the immune-mediated damage to the liver in autoimmune hepatitis. It does not stimulate liver regeneration, increase bile flow, or directly reduce inflammation. Question 42. A nurse is caring for a patient with Wegener's granulomatosis with polyangiitis. Which clinical finding is most characteristic of this condition? A. Malar rash. B. Hematuria. C. Ascites. D. Bradycardia. Answer. B. Hematuria. Rationale. Hematuria is a characteristic finding in Wegener's granulomatosis due to renal involvement. Malar rash is associated with SLE, ascites with liver disease, and bradycardia is not a typical feature. Question 43. A patient with HIV is experiencing persistent diarrhea. Which opportunistic infection is most likely the cause? A. Candida albicans. B. Cryptosporidium parvum. C. Pneumocystis jirovecii. D. Mycobacterium avium complex. Question 43. Answer: B. Cryptosporidium parvum. Rationale: Cryptosporidium parvum is a common cause of persistent diarrhea in HIV patients. Candida albicans causes oral and esophageal thrush, Pneumocystis jirovecii causes pneumonia, and Mycobacterium avium complex can cause systemic infections but not typically diarrhea. Question 44. A nurse is caring for a patient with autoimmune thrombocytopenic purpura, ITP. Which laboratory result is most indicative of this condition? A. Low platelet count. B. Elevated white blood cell count. C. Increased hemoglobin level. D. High erythrocyte sedimentation rate, ESR. Answer: A. Low platelet count. Rationale: a low platelet count is the hallmark of autoimmune thrombocytopenic purpura, ITP, as the immune system destroys platelets. Elevated white blood cell count, increased hemoglobin, and high ESR are not specific indicators of ITP. Question 45. A patient with systemic lupus erythematosus, SLE, is experiencing nephritis. Which medication is likely to be prescribed to manage this complication? A. Prednisone. B. Methotrexate. C. Hydroxychloroquine. D. Azathioprine. Answer: A. Prednisone. Rationale: prednisone, a corticosteroid, is commonly used to manage lupus nephritis due to its potent anti-inflammatory and immunosuppressive effects. Methotrexate, hydroxychloroquine, and azathioprine are used for other aspects of SLE management. Question 46. A patient with systemic sclerosis presents with pulmonary hypertension. Which class of medication is most likely to be prescribed? A. Beta blockers. B. Calcium channel blockers. C. Phosphodiesterase 5 inhibitors. D. ACE inhibitors. Answer: C. Phosphodiesterase 5 inhibitors. Rationale: phosphodiesterase 5 inhibitors, such as sildenafil, are often prescribed to manage pulmonary hypertension in systemic sclerosis. Beta blockers, calcium channel blockers, and ACE inhibitors are not first-line treatments for this condition. Question 47. A nurse is caring for a patient with autoimmune hemolytic anemia. Which laboratory finding is most likely to be observed? A. Decreased respiratory count. B. Elevated bilirubin level. C. Low hemoglobin level. D. Increased haptoglobin level. Answer: B. Elevated bilirubin level. Rationale: elevated bilirubin levels are commonly seen in autoimmune hemolytic anemia due to increased red blood cell breakdown. Decreased respiratory count, low hemoglobin, and increased haptoglobin are not characteristic findings. Question 48. A patient with multiple sclerosis, MS, is prescribed interferon beta. What is the primary action of this medication? A. Enhances nerve regeneration. B. Reduces inflammation and immune response. C. Stimulates myelin production. D. Inhibits acetylcholinesterase. Answer: B. Reduces inflammation and immune response. Rationale: interferon beta reduces inflammation and modulates the immune response in patients with MS, helping to decrease the frequency and severity of relapses. It does not enhance nerve regeneration, stimulate myelin production, or inhibit acetylcholinesterase. Question 49. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who is pregnant. Which medication is considered safe to use during pregnancy? A. Methotrexate. B. Cyclophosphamide. C. Hydroxychloroquine. D. Mycophenolate mofetil. Answer: C. Hydroxychloroquine. Rationale: hydroxychloroquine is considered safe for use during pregnancy and is often continued in SLE patients to manage symptoms and prevent flares. Methotrexate, cyclophosphamide, and mycophenolate mofetil are contraindicated due to teratogenic effects. Question 50. A nurse is educating a patient with Goodpasture syndrome about their condition. What is the primary focus of this education? A. Importance of blood pressure monitoring. B. Need for frequent blood transfusions. C. Use of immunosuppressive therapy. D. Avoidance of sun exposure. Answer: C. Use of immunosuppressive therapy. Rationale: Goodpasture syndrome is treated with immunosuppressive therapy to reduce the autoimmune attack on the lungs and kidneys. Blood pressure monitoring and blood transfusions may be necessary in some cases, but they are not the primary focus. Sun exposure avoidance is not relevant to Goodpasture syndrome. Question 51. A patient with systemic sclerosis, scleroderma, is experiencing severe skin tightening and contractures. What is the primary treatment goal? A. Reduce skin inflammation. B. Improve skin hydration. C. Prevent further contractures. D. Increase skin elasticity. Answer: C. Prevent further contractures. Rationale: the primary treatment goal for systemic sclerosis with severe skin tightening is to prevent further contractures through physical therapy and other interventions. Reducing inflammation and improving hydration are also important but secondary. Question 52. A nurse is educating a patient with hereditary angioedema about avoiding triggers. Which of the following should be included in the teaching? A. Avoiding strenuous exercise. B. Limiting fluid intake. C. Using ACE inhibitors. D. Avoiding contact sports. Answer: D. Avoiding contact sports. Rationale: avoiding contact sports can help prevent trauma-induced angioedema attacks in patients with hereditary angioedema. Strenuous exercise and limiting fluid intake are not relevant, and ACE inhibitors should be avoided as they can trigger attacks. Question 53. A patient with Hashimoto's thyroiditis is at increased risk for developing which condition? A. Hyperthyroidism. B. Addison's disease. C. Type 1 diabetes. D. Systemic sclerosis. Answer: C. Type 1 diabetes. Rationale: Hashimoto's thyroiditis is an autoimmune disorder, and patients with one autoimmune condition are at increased risk for developing others, such as type 1 diabetes. Hyperthyroidism, Addison's disease, and systemic sclerosis are less commonly associated. Question 54. A nurse is caring for a patient with multiple myeloma. Which laboratory finding is most indicative of this disease? A. Elevated white blood cell count. B. Hypercalcemia. C. Hypokalemia. D. Increased hematocrit. Answer: B. Hypercalcemia. Rationale: hypercalcemia is a common finding in multiple myeloma due to bone breakdown and release of calcium into the bloodstream. Elevated white blood cell count, hypokalemia, and increased hematocrit are not specific to multiple myeloma. Question 55. A patient with systemic sclerosis presents with severe gastrointestinal symptoms. Which medication may be prescribed to manage esophageal dysmotility? A. Proton pump inhibitors. B. Beta blockers. C. Anticholinergics. D. ACE inhibitors. Answer: A. Proton pump inhibitors. Rationale: proton pump inhibitors can help manage esophageal dysmotility and gastroesophageal reflux in patients with systemic sclerosis by reducing stomach acid production. Beta blockers, anticholinergics, and ACE inhibitors are not indicated for this symptom. Question 56. A patient with chronic idiopathic urticaria is not responding to standard antihistamine treatment. What additional medication might be considered? A. Beta blockers. B. Leukotriene receptor antagonists. C. Calcium channel blockers. D. ACE inhibitors. Answer: B. Leukotriene receptor antagonists. Rationale: leukotriene receptor antagonists, such as montelukast, can be used as an adjunct therapy in chronic idiopathic urticaria when antihistamines alone are insufficient. Beta blockers, calcium channel blockers, and ACE inhibitors are not indicated for this condition. Question 57. A patient with chronic lymphocytic leukemia, CLL, is being treated with rituximab. What is the primary target of this medication? A. T lymphocytes. B. B lymphocytes. C. Myeloid cells. D. Erythrocytes. Answer: B. B lymphocytes. Rationale: rituximab is a monoclonal antibody that targets CD20, a protein found on the surface of B lymphocytes. It helps to deplete B cells in conditions such as CLL. It does not target T lymphocytes, myeloid cells, or erythrocytes. Question 58. A patient with Sjogren's syndrome is experiencing severe dry eyes. Which over-the-counter medication can help alleviate this symptom? A. Artificial tears. B. Antihistamines. C. Decongestants. D. NSAIDs. Answer: A. Artificial tears. Rationale: artificial tears are commonly used to alleviate dry eyes in Sjogren's syndrome by providing lubrication. Antihistamines and decongestants can worsen dry eyes, and NSAIDs are not used for this symptom. Question 59. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who has developed antiphospholipid syndrome. What is the primary treatment goal for this condition? A. Reduce inflammation. B. Prevent thrombosis. C. Control blood pressure. D. Manage renal function. Answer: B. Prevent thrombosis. Rationale: antiphospholipid syndrome is associated with an increased risk of thrombosis. The primary treatment goal is to prevent clot formation, often using anticoagulants like warfarin. Reducing inflammation, controlling blood pressure, and managing renal function are important but secondary to preventing thrombosis. Question 60. A nurse is caring for a patient with autoimmune thrombocytopenic purpura, ITP. Which laboratory result is most indicative of this condition? A. Low platelet count. B. Elevated white blood cell count. C. Increased hemoglobin level. D. High erythrocyte sedimentation rate, ESR. Answer: A. Low platelet count. Rationale: a low platelet count is the hallmark of autoimmune thrombocytopenic purpura, ITP, as the immune system destroys platelets. Elevated white blood cell count, increased hemoglobin, and high ESR are not specific indicators of ITP. Question 61. A patient with Hashimoto's thyroiditis is being monitored for hypothyroidism. Which sign or symptom is most indicative of this condition? A. Heat intolerance. B. Tachycardia. C. Weight gain. D. Insomnia. Answer: C. Weight gain. Rationale: weight gain is a common symptom of hypothyroidism due to decreased metabolism. Heat intolerance and tachycardia are symptoms of hyperthyroidism, while insomnia is not typically associated with hypothyroidism. Question 62. A nurse is caring for a patient with polyarteritis nodosa. Which organ system is most likely to be affected by this condition? A. Central nervous system. B. Gastrointestinal system. C. Cardiovascular system. D. Renal system. Answer: D. Renal system. Rationale: polyarteritis nodosa commonly affects the renal system, leading to hypertension and renal insufficiency. While other systems can be involved, renal involvement is a hallmark of the disease. Question 63. A nurse is educating a patient with Raynaud's phenomenon secondary to scleroderma. Which lifestyle modification should be recommended? A. Engage in regular aerobic exercise. B. Increase sodium intake. C. Avoid cold exposure. D. Use hot compresses on affected areas. Answer: C. Avoid cold exposure. Rationale: avoiding cold exposure is crucial in managing Raynaud's phenomenon, as cold can trigger vasospasm and worsen symptoms. Regular aerobic exercise is beneficial for overall health but is not specific to Raynaud's. Increasing sodium intake and using hot compresses are not recommended strategies. Question 64. A patient with primary biliary cholangitis, PBC, presents with pruritus and fatigue. Which medication is most commonly prescribed to manage these symptoms? A. Ursodeoxycholic acid. B. Methotrexate. C. Azathioprine. D. Cyclosporin. Answer: A. Ursodeoxycholic acid. Rationale: ursodeoxycholic acid is commonly prescribed to manage pruritus and slow disease progression in primary biliary cholangitis. Methotrexate, azathioprine, and cyclosporin are not first-line treatments for PBC. Question 65. A patient with hereditary angioedema is experiencing an acute attack. Which medication is most appropriate for immediate treatment? A. ACE inhibitor. B. Antihistamine. C. Fresh frozen plasma. D. C1 esterase inhibitor. Answer: D. C1 esterase inhibitor. Rationale: C1 esterase inhibitor is used to treat acute attacks of hereditary angioedema by replacing the deficient protein. ACE inhibitors are contraindicated, and antihistamines and fresh frozen plasma are not first-line treatments for acute attacks. Question 66. A patient with autoimmune hemolytic anemia is being treated with corticosteroids. Which laboratory result would indicate a positive response to treatment? A. Decreased respiratory count. B. Increased hemoglobin level. C. Elevated bilirubin level. D. Low haptoglobin level. Answer: B. Increased hemoglobin level. Rationale: an increase in hemoglobin levels would indicate a positive response to treatment as it suggests a reduction in hemolysis. A decreased respiratory count, elevated bilirubin, and low haptoglobin are associated with ongoing hemolysis. Question 67. A patient with Wegener's granulomatosis with polyangiitis, is receiving cyclophosphamide therapy. What is the primary adverse effect the nurse should monitor for? A. Hypertension. B. Hemorrhagic cystitis. C. Hyperglycemia. D. Bradycardia. Answer: B. Hemorrhagic cystitis. Rationale: cyclophosphamide can cause hemorrhagic cystitis due to its toxic effects on the bladder. Monitoring for signs of hematuria and ensuring adequate hydration are essential. Hypertension, hyperglycemia, and bradycardia are not typical adverse effects of cyclophosphamide. Question 68. A nurse is educating a patient with Sjogren's syndrome about managing their symptoms. Which recommendation is most appropriate? A. Use high-dose corticosteroids daily. B. Increase intake of caffeinated beverages. C. Use artificial tears and saliva substitutes. D. Restrict fluid intake. Answer: C. Use artificial tears and saliva substitutes. Rationale: Sjogren's syndrome primarily affects the exocrine glands, leading to dry eyes and mouth. Using artificial tears and saliva substitutes can help manage these symptoms. High-dose corticosteroids are not typically used for symptom management, and caffeinated beverages and fluid restriction are not advised. Question 69. A patient with systemic lupus erythematosus, SLE, is experiencing pericarditis. What is the most appropriate initial intervention? A. Administer NSAIDs. B. Start antibiotic therapy. C. Initiate corticosteroid treatment. D. Begin anticoagulant therapy. Answer: A. Administer NSAIDs. Rationale: NSAIDs are often the first line of treatment for pericarditis to reduce inflammation and pain. Corticosteroids may be used if NSAIDs are not effective, but antibiotics and anticoagulants are not indicated for pericarditis unless there are specific indications. Question 70. A patient with systemic lupus erythematosus, SLE, is experiencing a skin rash. Which type of rash is most characteristic of this condition? A. Erythema migrans. B. Butterfly rash. C. Vesicular rash. D. Bullous rash. Answer: B. Butterfly rash. Rationale: a butterfly rash or malar rash across the cheeks and bridge of the nose is characteristic of SLE. Erythema migrans is associated with Lyme disease, while vesicular and bullous rashes are associated with other conditions. Question 71. A patient with Guillain-Barré syndrome, GBS, is experiencing ascending paralysis. What is the most critical assessment to prioritize? A. Blood pressure monitoring. B. Reflex assessment. C. Respiratory status. D. Pain level. Question 71. Answer: C. Respiratory status. Rationale: GBS can lead to rapid progression of muscle weakness, including the respiratory muscles. Monitoring respiratory status is critical to identify early signs of respiratory failure. Blood pressure, reflexes, and pain are also important but not as critical as respiratory assessment. Question 72. A nurse is caring for a patient with systemic lupus erythematosus, SLE, who is experiencing nephritis. Which laboratory test is most important to monitor? A. Complete blood count, CBC. B. Serum creatinine. C. Liver function tests, LFTs. D. Serum calcium. Answer: B. Serum creatinine. Rationale: serum creatinine is an important indicator of kidney function and should be closely monitored in SLE patients with nephritis. CBC, LFTs, and serum calcium are also important but not as directly related to nephritis. Question 73. A patient with autoimmune hepatitis is experiencing elevated liver enzymes. Which diagnostic test is most specific for confirming this diagnosis? A. Anti-smooth muscle antibody test. B. Liver biopsy. C. Serum bilirubin. D. Hepatitis B surface antigen. Answer: A. Anti-smooth muscle antibody test. Rationale: the anti-smooth muscle antibody test is specific for autoimmune hepatitis. Liver biopsy can confirm the extent of liver damage but is not as specific for the diagnosis. Serum bilirubin and hepatitis B surface antigen tests are not specific for autoimmune hepatitis. Question 74. A patient with systemic sclerosis presents with pulmonary arterial hypertension, PAH. Which diagnostic test is most specific for confirming PAH? A. Chest X-ray. B. Electrocardiogram ECG. C. Echocardiogram. D. Right heart catheterization. Answer: D. Right heart catheterization. Rationale: right heart catheterization is the gold standard for diagnosing pulmonary arterial hypertension by directly measuring pulmonary artery pressures. Chest X-ray ECG and echocardiogram can suggest PAH but are not definitive diagnostic tests. Question 75. A patient with multiple sclerosis, MS, is experiencing severe spasticity. Which medication is commonly prescribed to manage this symptom? A. Baclofen. B. Methotrexate. C. Prednisone. D. Interferon beta. Answer: A. Baclofen. Rationale: baclofen is a muscle relaxant commonly prescribed to manage spasticity in MS patients. Methotrexate and prednisone are not used for spasticity, and interferon beta is used to reduce inflammation and immune response.